having a breast reduction if you've already had a breast reduction in the past. Right, okay, good question. Thank you very much for that question. In fact, thank you for all of these questions, because they're all good questions, but this is a particularly good question because it's from a patient of mine who's had a breast reduction, who's delighted, very pleased with the breast reduction, and I'm very pleased about that, but she still feels her breasts are too big. And this is not uncommon. People having breast reduction saying, yeah, no, I'm really good, but you know what, I wish it was a bit smaller. I guess it's a bit like people having breast augmentation saying they wish it was a bit bigger. Maybe it's not like that at all, actually. No, it's not really like that, but it's like that in terms of people not being 100% happy with the size that you make them. That's one of the not the perks of the job. What's the opposite of perk? One of the problems, or one of the issues with the job, is number one, making people happy, because always trying to make what you have in your mind to be what the patient has in their mind. I was just doing a case just now with one of my colleagues, and we thought it looked really good at the end of the operation, and really it doesn't really matter what we think, it matters what the patient thinks. So that is one of the challenges of aesthetic surgery, of cosmetic surgery, when you're doing things for aesthetic reasons. For it is very much in the eye of the beholder, or well, the beholder being the person looking in the mirror. I guess that still works. Yeah. Okay. So where was I? So that the question about people having a breast reduction and wanting another breast reduction, that's the question. Yes. Short answer, yes, you can have another breast reduction. But a couple of riders. I'm going to put a couple of riders on there. First rider, something that I always try and tell people preoperatively with regards to size when you're doing a breast reduction. The bigger the breasts are before you start, the bigger they will be when you finish, because when you do a breast reduction, you have to keep a stalk of tissue. We call it a pedicle. Pedicle being like a stalk of tissue going towards the nipple. Now you can do a free nipple graft where you take the nipple off and put the nipple back on as a graft. I don't like doing that. I don't think it's a very nice, personally, I don't think it's a very nice way of doing it. We always get problems with numbness in the nipple. You get lack of projection of the nipple, and that doesn't stick out very much. So there are issues with it. It's only, in my hands, it's only for people with very, very big breasts. So if you do a free nipple graft where you take the nipple off and put it back on again, then you can make them any size you want, really. You can, that's how you make women into men, really. So you can do it that way. But in my view, it is far better to keep the nipple alive rather than taking it off and putting it back as a graft. So that means keeping a stalk of tissue going to the nipple. And the bigger your breasts are, the lower they are. It's the nipple areolar complex transposition. It's how far the nipple areolar complex moves is the issue. So the lower they are and the further they have to move, the longer the stalk will be. And when you do the breast reduction, that stalk will carry with it a certain amount of bulk and a certain amount of volume. That's why people who are very big, we can't make them really, really small, because you would jeopardize the vascularity of the nipple. You would just jeopardize the blood supply to the nipple. You can lose the nipple when you do a breast reduction. You can also just jeopardize the nerve supply to the nipple, so the sensation can be altered. The milk ducts can be interrupted, so you might not be able to breastfeed. So you try and leave as much of the normal structures going to the nipple as you can, but the longer it is, the more of those structures you're going to be dividing. And so you want to make it as bulky as possible to keep all the nerve supply, the blood supply, and the milk ducts going to the nipple, but that makes the breast bigger. Ooh. Ooh. Sorry about that. So that's the reason why they're often a bit big. That's why I try and make it clear to people preoperatively that they will be a certain size. That's number 1 point. So I think I've got 3 points on this question. Number 2 point, I would say, is yes, you can have another breast reduction. If you have another breast reduction, you've already had a breast reduction or you've had a breast lift, the surgeon needs to know how they did the original surgery. Now, obviously, I did the original surgery in this patient, and if she wants me to do it again, we're all happy about that because I know what I did. But if she went to another surgeon, or if someone came to me having had a breast reduction and wants another breast reduction, I would need to ideally get the operation note from the other surgeon. It's fine, just write to the other surgeon or the clinic or whatever, and they should give it to you without a problem. Just like I would give you your operation note if you wanted it. Has it gone dark? Is that me? Hi, Angela. Nice to see you. Good to have you here today. So you need to know the way because when you make that stalk, when you make that pedicle, you can make it in different ways. You can make it based at the top. It's called a superior pedicle. Based on the bottom, it's called an inferior pedicle. Laterally, you can have it bipedicle. You can have it laterally both sides or horizontally both sides. Supromedial. You can have all different types of pedicle. And the surgeon who does the surgery again has to use the same pedicle, because if you have the nipple based on a superior pedicle, if you've got it attached at the top, and then another surgeon says, "Oh, I'm going to do another breast reduction and I'm going to attach it at the bottom," well, then you've just cut that pedicle, and the nipple, then the pedicle is based on scar tissue, which is bad, and which is high risk of nipple dying. So the risks are increased when you have a revision breast reduction, when you have a second time breast reduction, because there's scar all over the place, and you have to make sure you use the same pedicle. But it is possible to do, but it's something that you need to do carefully, and you need to try and make sure you have as much information as possible. And then the third point 3, I want to make on this question, which is just demonstrates what a great question it is be careful what you wish for. I always say to people before they have breast reduction, what size do you want to be? And they say, I want to be this or that, whatever. And I always say, I can't guarantee it, because I ask for size because we always go on size. But what I'm trying to do, and what we're often trying to do when we're doing a breast reduction, is trying to make the shape right. You've got to make it like a pyramid. The nipple's got to be at the apex of the pyramid. You've got to make the width right. You've got to make it proportionate to your frame. Often people who require a breast reduction, their breasts are not in proportion with their body. They're not in proportion with their frame. And so that's what you're trying to do when you do a breast reduction. Sometimes people, when they say, I want to be a B cup or something like that, they don't realize what a B cup will be in them. And it might be that might be a bit small. It might lack projection. It might be a bit flat. You don't want them to be flat because the nipple, like pancakes and nipple there. It doesn't look good. You need to have some projection there. And if you've got a certain width to your chest, you need a certain width to your breast. Nice shape. Shape's important, I believe. So you want a nice shape. I know people say, oh, back pain, all that, but obviously you're going to reduce the volume, make them more in keeping with your frame. But really, the shape is really, I think, is important when you do a breast reduction, and that again will be a reason to have it a certain size.